Addiction and opioid use disorder, and really addiction of all forms, is, it's a chronic disease. It's not something we're going to fix with a pill one time. And so the nature of this disease is that people will come and go from care. And one of the ways that we engage people is really by creating a really welcoming environment. And so that really starts from the front desk. It starts with the MAs who room the patients. It starts with the providers who see them, the BH who sees them, the lab techs who draw their blood. It's really kind of a whole clinic approach to the patient, that, this is a safe place. This is where they can be honest.
So many patients, when they come in, they're just very eager and happy to have an option and support for treatment that's very accessible for them. And I think, oftentimes patients are very worried they're going to be judged by providers, by clinic staff, be looked upon negatively for their behaviors or their histories. And we really work to upfront alleviate a lot of that.
We are here to help them. We are here to help them get through this process that they are going through. It is a very difficult process, but that's why we are here, because a lot of patients don't have that support system that they need. So that's why we are here. We are their support system. We can be a friend in need if they just need somebody to talk to.
I think about growing up and how you may have judged the population and people would tell you to stay away because they might not be the safest people, and not understanding where they're coming from, and now being a front office employee and offering them the help and them wanting to actually take the help from you and seeing their actual background, their stories, how they might have started on their substance abuse, and then now for them getting the help and wanting to understand, this is why I want to get the help. Maybe it may be their children or their families or even for themselves. It's been quite a rewarding experience for myself. It's taught me to be more patient and more understanding and not be so quick to judge somebody just by their face and what they're doing, but to learn that background first.
You see them weekly, so you get to really know them, their lives. A lot of times they come with family members or friends that are supporting them, and you get to know more about them personally.
The opiate epidemic has reached heights beyond that of what the HIV epidemic was, and it's really about, again, not only meeting the needs of our community and our patients, but helping just in terms of healthcare and resources and access in general for other providers as well. But it's been very positive for our staff as well, also helping to destigmatize how support staff or providers kind of really think about opiate use disorders and how we treat that and how to approach it, and to really bring it into the fold of primary care and just really upfront say that this is a place of, non-judgmental care and really welcoming patients, very happy that they're here, and that we really do approach this like we should, that this is chronic disease management, and that we really are happy to have patients come in, happy to have them not only in care for their opiate use disorder, but getting them into primary care. For a lot of people, this is their first primary care experience in a long time. They haven't had any health care. And so really trying to destigmatize not only their opiate use disorder, but really how they're thinking they're going to be treated by providers and staff, and very much being non-judgmental and welcoming, and just really being very straightforward and honest with them that we are very happy to serve them, and that this is a really positive step that takes a lot of strength, and that we're there to support them.
Looking forward and kind of ways that people can continue to support is really just by continuing to spread the word, continuing to support what's happening locally, whether that's through grant funding or through looking at what's happening in your legislature and kind of your local community politics, and kind of what's happening there to support treatment and expand access. And then ultimately, I think, if you're willing to, I think helping us out at HealthPoint's, whether it's financially or calling and see if there's a way you can volunteer to perhaps be someone who could help bring patients back. There's lots of ways to support, and I think there's lots of ways that we can improve our programming, and lots of ways that we continue to extend our reach into our communities to create a healthier space and a safer place for everyone.